Carriage House Community Table provides mental health outreach, which we get from the Mental Health Center. We offer groups specifically around mental health issues, and we pay for people's psychiatric medications frequently when they need help. It's a neighborhood, you know, and it's wonderful for me to come here, and if I haven't been here for a while, you know, I'll make mistakes, I'll go on little vacations, and when I come back, nobody does what I think of on the way here as of, oh my gosh, people are gonna mock me, people are gonna put me down, I've just gotten out of jail again. I walk in and it's such a lighter side to the whole situation that I thought it would be.
You can come here and talk to people without being judged, which is really nice. And everybody's trying, most of the people here are trying to better themselves one way or another.
Being homeless, being on the streets, I mean, you get to know everyone who is going through the same exact situation of being homeless, be addictions, being mental health. It's really simple to get caught up in whatever illness that one has.
I was just diagnosed about 2 months ago with a mental illness, and it was hard to accept at first, but reading more about it and having people to talk to really helped.
A lot of people with pretty significant mental illness, particularly I would say depression and PTSD, don't realize they have it. That's really true. They just know they feel terrible all the time.
The recovery rates for mental illness are higher than those for cancer or coronary heart disease. But people don't realize that. They think if someone gets a diagnosis of schizophrenia or bipolar disorder or chronic depression, that they're going to be non-functional for the rest of their lives and not able to participate in the community, and that's far from true.
You get mad at yourself. Having a lot of, you know, hate's a strong word. Just anger at yourself for not taking the opportunities when you run into other people who have done it and they tell you things as of, you know, well, that's the simplest thing you can do. No, it's not. For someone like me, that is an unbelievable hard steps for me that I had taken in the past. But I feel I'm doing pretty good now. Well, we have lots of outreach workers here at the Carriage House, and that's a very conscious choice. This is a place where homeless and poor people feel comfortable and connected, and they meet the outreach workers here, form a relationship, and then it's easier for them to transition to those other services.
I became homeless over certain situations that happened in my life. And with the Carriage House, it helps me out with a lot of services, including medical prescriptions and bus rides and stuff like that. I use the classes here, which helps me out with one of my diseases.
Part of the recovery model requires a holistic approach to recovery, and so the fact that you offer job services, housing services, people getting IDs, people getting mental health services, food, shelter, all those basic needs that a lot of us take for granted is really integral to recovery and vital for the community.
However, these are complex issues, and it takes a great deal of time to build these kinds of trusting relationships that help people understand that they are suffering from a biological illness, that they're not crazy, that they're not worthless, that they deserve to live the healthiest life that they possibly can.
I like working at Carriage House as a mental health worker because there's access to a lot of services through Carriage House. I mean, if somebody is starting medication, they can get and can't pay for it. You know, Carriage House can pay for their medications. If they have no clothes, Carriage House has a clothing bank.
The Carriage House is an integral part of the community and vital in the services it provides.
I've become completely dependent on the Carriage House in this whole whirlwind of the life that I'm trying to create for myself.
I was trying to get help before all the legal system came up on me, and it was very, very hard to get help. They always wanted me, or anybody that went in there, they wanted 3 to 6 months sobriety time, and that's hard to get when you don't even know. It's hard to get into that position to get the sobriety or get into the mental health situation. And from the Carriage House, they worked with you. They worked with you while you were drinking and supported you towards your sobriety. They didn't make you wait 6 months to come here, which is what I needed, a lot of people need.
We need your help to fund the mental health services at the Carriage House. Specifically, we need your help to purchase the services from the mental health center for the outreach worker, and we need your help for our prescription fund.